Quiz 1 on the adductor compartment of the thigh. Here is the question number 1. Actually, it is a statement. You can answer by yourself whether this is true or false. First, the muscles in the adductor compartment are primarily innervated by the obturator nerve. Yeah, this statement is true because we know the muscles of the adductor compartment are pectineus, adductor brevis, adductor longus, adductor magnus, gracilis, and obturator externus. So out of these muscles, most of them are innervated by the obturator nerve, either by the anterior division or the posterior division. So gracilis is innervated by the anterior division of the obturator nerve as well as adductor longus and adductor brevis. When it comes to adductor magnus, you know it has two parts. The hamstring part innervated by the tibial part of sciatic nerve and the rest of the magnus by the posterior division of the obturator nerve. Then again the obturator externus also the posterior division of the obturator nerve. When it comes to pectineus, it has dual nerve supply sometimes from the anterior division of the femoral nerve, usually supplies the pectineus, and sometimes it receives a tweak from the anterior division of the obturator nerve as well. Statement number 2, the adductor magnus is a composite muscle. I think by now you know the answer. It is true because adductor magnus consists of two parts. Actually, it contains more than one set of fibers, hamstring and adductor part. Composite muscle or hybrid muscle are those muscles contain more than one set of fibers, but their action is same and their innervation is different. You know, just now we discussed the nerve supply of the adductor magnus, which is from the femoral nerve and the obturator nerve. Statement 3. The gracilis muscle contributes to the formation of the pes anserinus. The answer is true. Pes anserinus is the conjoint tendon of sartorius, gracilis and semitendinosus, and they inserts onto the anteromedial proximal tibia. Statement number 4. The femoral artery passes through the adductor canal but not through the adductor hiatus. The answer is false because the femoral artery enters into the popliteal region by the adductor hiatus and becomes the popliteal artery. Statement number 5. The obturator artery is always a direct branch of the internal iliac artery because sometimes it arises from other arteries as well. So the answer is false. Obturator artery usually arises from the internal iliac, but it may arise from external iliac or from the inferior epigastric artery in a few percentage of individuals. Statement number 7. The adductor longus muscle forms the medial boundary of the femoral triangle. The answer is true. If we look into the boundaries of the femoral triangle, superiorly we have inguinal ligament, then laterally we have the medial border of the sartorius muscle, and then medially we have the medial border of the adductor longus muscle. Statement number 8. The adductor canal transmits the saphenous nerve along with the femoral vein and artery. The answer is true. If you remember the contents of the adductor canal or subsartorial canal, it contains femoral artery, femoral vein, saphenous nerve, and nerve to vastus medialis in its upper part. Statement number 9. The main function of the adductor muscles is extension of the hip joint. If you pay attention to this wording, extension of the hip joint, by now you know this is false because adductors are act on the thigh to do the adduction. But in addition, here it should be gracilis. Gracilis, you know, it inserts into the tibia and it helps to flex the knee joint and medially rotates the leg when the knee is flexed. And the adductor magnus, the part arises from the ischial bone. It acts with the hamstring muscle to extend the hip joint. These adductors not only help to adduction of the thigh, but also it helps to stabilize the hip bone on the femur and prevent it from laterally tilting when standing on one leg, and they also support body weight while walking. Statement number 10. The obturator nerve emerges from the lumbar plexus, especially from roots L2 to L4. This answer is correct because it arises from the lumbar plexus in the abdomen from the anterior divisions of L2, L3, L4 lumbar nerves. Thank you very much and stay connected with Anatomy Everywhere YouTube channel.